Joining me now are doctors of physical therapy, Brandon Whittington and Maya Ramos-Allen at Level Up Physical Therapy in Calabash. Thanks so much for being with us, guys.
Thanks for having us.
So y'all opened this practice up fairly recently. Tell me, why'd y'all decide to go into physical therapy and move to Calabash? Brandon, you want to start?
Yeah, so physical therapy was actually a second career choice for me and for my wife. We initially got out of getting a biology degree, and we kind of weren't sure where we wanted to go at first. You know, the jobs are kind of not the greatest in that field, and I was working a little bit in the biology field. I felt disconnected from the change I was causing with the work I was doing. So a friend of ours had an accident where he actually fell out of a lighthouse and had a brain injury. And we went and saw him in the hospital, and we saw these physical therapists. We didn't know what they were at the time, but we saw people working with my friend, and essentially we were just amazed by the kind of stuff they were doing. We couldn't do anything for our friend at that time, but these people were able to help him. We looked into the physical therapy a little bit more, and we really gained respect for the field and the passion. So we followed that dream and went to school together, actually, in 2012, and got her doctorate in 2015.
Okay, so y'all are husband and wife team.
Yeah.
Did y'all meet, did you know that you were going to be physical therapists when you met, or is this something that you kind of fell into after you met, or?
It occurred after we met. When we first met, we were still in undergraduate school and getting our biology degrees. So we went through the decision process and becoming physical therapists after we had already met and been together. So. Okay,
wow. So how did y'all end up here in Calabash? I know you opened this practice fairly recently.
Mm-hmm. Well, we did a search of where we wanted to open our own clinic because we had previously been working at another physical therapy clinic owned by a physical therapist, and decided that it was time for us to do the same thing ourselves in a different place. And you might want to expand a little bit on the search that you did.
Yeah, we actually looked up, probably several dozen different areas to kind of move to before we made a decision on it. We were looking at four main things. We don't want to be too far from family because family is important to us. We were looking at an area. We had previously been treating an aging population. We really enjoyed that population, so this was kind of an area is good for that. We looked at a small town, and I grew up in the beach, and I really love the beach. So for us, we're looking for an area with all four of those things. And out of all the areas we found, this area had great growth. It just looked perfect, and we came and visited. That was it. We visited one time, we made that decision.
Yeah, so as you said, you really do enjoy being here. And you are a small practice, and you intend to stay that way. I know you were telling me before we started. So just expand on that and talk about the personal service that y'all offer.
So our clinic, we really value the personal relationship with the patient. So for us, we offer a full hour-long session if the patient needs that. We give that whole time for each session. So the evaluation's an hour, and each treatment we have up to an hour to work with that patient. And what's really nice is that every time the patient comes in, they can expect the same doctor of physical therapy. We don't have any technicians. We don't have any assistants. We really value that patient care, so we look at making sure nothing gets lost in communication, that you have a familiar experience every time, and we think that gets patients better quicker.
Okay, and what services do you offer? I know you do fall prevention. That's one of the big things you offer. But if somebody's in an accident and they need physical therapy, you're able to offer that too.
Yes, we can treat patients for a variety of injuries or post-operatively. Any sort of joint issues or joint pain, any kind of condition that's neurological, that it's very expansive what we can treat, very broad.
Okay, and I wanted to ask about fall prevention. That's a huge thing in this area.
Yeah, that's one of the things we treat. We've kind of been in a position where we really treat a lot of that in a previous employer. It's kind of one of the main things we did there. And I said we were working previously in the aging population in a small town called South Hill. And we really love to do that. So we came here and we realized that that's something this community needs as well. There's a lot of people here who are having trouble with balance, and falls are a really big deal. A lot of people, especially older adults, every year it's estimated that 1 in 4 older adults will fall. And falls are the number one reason for hip fractures. And it's estimated that every 20 seconds somebody, an older adult dies from a fall. So I mean, it's a really big deal, and a lot of people, I think that this is an area we can make a big difference.
Yeah, at what age should somebody start thinking about getting a fall screening?
The CDC recommends a fall risk assessment for individuals 65 and older on a yearly basis.
Yeah, so annually, everybody 65 and older, according to the CDC, the Center for Disease Control, it's recommended that every person 65 and older gets one of these screenings annually. Just like they get their checkup, you get your eyes checked, you should get a balanced fall screening from a physical therapist or every year.
Okay, what should somebody expect when they do a fall screening?
Okay, so the first step of the fall screening is actually a little questionnaire. We can administer questions ourselves too for that portion, and then after that we do a short assessment of walking, which is gait, and balance and strength. And so there's 3 little tests done. They're pretty simple and quick to administer. And after that, we do our assessment with the patient to determine what risk category they fall under, whether it's low risk, moderate risk, or high risk for falls, and then just discuss the best options for the, given what category they fall under.
Every time we do, we don't recommend physical therapy. It's not like somebody comes in, they get a fall screening, and then we say, oh, you need physical therapy.
Right.
Actually, the majority of people come in, we've been able to send them to community type things. We've been able to send them to do yoga or Pilates or the different kinds of outside things, but a good percentage also do need physical therapy. It's a legitimate fall risk for them. And those people, they don't have to come here just because they get the screening done, but they need to have that service.
So you're able to work with them to find some kind of plan to improve their balance, whether it be physical therapy or something else.
Yeah.
Yes.
Okay, and what has the response been like from your clients?
Overall, people seem to really appreciate it. We've had some good feedback on Facebook. Some people have posted things. People come in here seem to really appreciate just the easy access. You don't need a referral to do it. You don't need any kind of recommendation. People can just walk in anytime they think they need it, and that, I think, having that open, easy access. There's so many barriers to people getting fall risk. Some people think they don't need it, or they're embarrassed about their balance. They don't want to be put on cane, or think that they're getting older and they have to, do these special things. But I think it's good to open that door, and the easier it is for people to get in and get seen, the more likely more people will come. And so far, we've had really good response.
Yeah, the earlier that you get screened, the better you can plan as you get older.
And that's true. And a very important thing to keep in mind is that even if you don't actually need the physical therapy at the time, it puts a baseline. So if you come at 70 and you do it every year, we can kind of track how things change over time. So we'll know if this is your normal, or hey, look, things got a little worse, we may want to do something about that.
Okay, and if somebody is looking for your services, do they need a referral, or can they just stop on in?
A referral is not required in the state of North Carolina for physical therapy to be initiated. So they can stop in anytime, and we actually take walk-ins too if the time is available to us. So if we're not currently with a patient, we can see somebody on the spot pretty much. All
right, well, as we close our time together, how can somebody get in touch with y'all at Level Up Physical Therapy, and where are y'all located?
So we're just across the street from Bennett in the heart of Calabash. And we got Bloomingdale's. We also have next to us the Headhunters Barbershop. These are the areas I've heard are kind of the hot spots people know.
So it's right here in the heart of Calabas.
Right here, yeah, we're right here with
Bloomingdale's on Beach Drive.
Yeah, so you can also give us a call. The number is 910-579-2745, or check out our website. If you look in, just Google Level Up Physical Therapy in Calabash, we're going to pop up. You'll find us.
Dr. Brandon Whittington and Dr. Maya Ramos-Allen, thanks so much for being with us here on Brunswick Biz. Appreciate it.
Really appreciate
Yes,
it.
thank you for
Thanks
coming
having
here.
us.